Bismillah ar-Rahman ar-Rahim. Notes on pulmonary rehabilitations. Pulmonary rehabilitation is an evidence-based multidisciplinary program of care for patients with symptomatic chronic respiratory impairment, and it targets the extrapulmonary manifestations of the disease, and the program is individually tailored and should contain high intensity progressive aerobic training, strength training, and self management education. What are the goals or aims of pulmonary rehabilitation? Aims are to reduce the disability in people with chronic lung disease and to diminish the healthcare burden of the disease and to improve quality of life and restore independence. Benefits of pulmonary rehabilitation include improvement of or reduction of the severity spectrum of chronic obstructive pulmonary disease. And there are which has been shown, studies have been shown that patients who complete the rehabilitation course may have a fewer hospital admissions for exacerbation than those who had not had rehabilitation, and hospital stay will be were shorter. It were 10 days versus 21 days. Respiratory muscle training improves dyspnea, but not exercise capacity or health related quality of life above aerobic training. Supplemental strength training improves muscle strength but does not provide additional benefit to exercise capacity or health related quality of life than aerobic training alone. High intensity lower limb aerobic training is recommended rather than low intensity training. Early pulmonary rehabilitation after COPD exacerbation is recommended. It is a safe and improves exercise tolerance, health related quality of life, and reduce hospital admissions. Short term program achieve overall similar outcome benefits across the spectrum of patient disability. A minimum program length of 6 weeks is recommended. Decline in exercise tolerance and health status tend to occur between 6 and 12 months after completion of a course of rehabilitation. Now, who are candidates for pulmonary rehabilitation? The candidates of pulmonary or for pulmonary rehabilitation include the following: anyone with or any patient with chronic lung disease causing functional impairment despite receiving optimum medical treatment, patients who are well motivated seem to benefit most, Patients with poor lower limb mobility may still benefit from upper limb exercise and education package. Oxygen therapy is not a contraindication for rehabilitation, and recent exacerbation of COPD is not a contraindication. Stable ischemic heart disease and heart failure are not contraindications. Depression should be addressed prior to participation in pulmonary rehabilitation, if possible, to increase the likelihood of benefit. Now, who are not a candidate or who are not indicated for pulmonary rehabilitations? Unstable ischemic heart disease, such as unstable angina or severe coronary syndrome disease, a severe valvular heart disease, severe cognitive impairment, or locomotor difficulties are contraindicated for pulmonary rehabilitation. Also, poorly motivated people with geogra- geographical geographical or transport problems making attendance difficult tend to do less well. It may, however, that different locations, community or home based, at different interfaces, manuals or web based may help these challenges of hospital based programs. So again, candidates in whom rehabilitation may not be indicated include unstable ischemic heart disease, severe valvular heart disease, or severe cognitive impairment or locomotor difficulties. Also, poorly motivated people with transport problems are contraindicated for pulmonary rehabilitation.